So I want to thank the organization to inviting me in this symposium, and also I'm very glad to be here with such a great professionist. So my speech is about exercise prescription in transplant recipients, the Italian programming. So in the literature, it is well known that exercise capacity is a very important variable because it's a predictor of survival among ambulatory patients with end-stage renal disease. And also exercise capacity is reduced in end-stage renal disease. After transplantation, exercise capacity increases significantly. However, over time, it does not further improve and patients remain low compared to the normal levels. Worldwide physical activity has become a very important element also to counteract disease like obesity or diabetes. And also physical inactivity is considered like a pandemic disease. And so as the fourth leading risk factor for a global mortality. So World Health Organization addressed recommendation on level of physical activity based on age group, indicated that significant health benefits can be obtained through 150 minutes per week of moderate physical activity. This recommendation is for the general population, but we can also consider it for chronic disease and transplant recipients as well. So why transplant recipients have to practice physical activity? Transplant recipients have a high risk of development of cardiovascular disease, much higher than in general population. For traditional cardiovascular disease, risk factors like obesity, diabetes, hypertension, and dyslipidemia then occur after transplantation for the side effect of immunosuppressive therapy, and also the transplant recipients increase their appetite after transplantation, so they increase their weight. And also non-traditional cardiovascular disease risk factors like duration of prior dialysis, graft function after transplantation, elevated inflammatory markers, proteinuria, toxic effects, side effects of immunosuppressive therapy, and also metabolism abnormalities and vascular calcification. So physical exercise can reduce these factors, also the risk of all-cause mortality, and is effective in the primary and secondary prevention of cardiovascular disease. But despite this, not all patients increase their physical activity after transplantation because they have different attitudes, like Adwin said in his presentation, like fears of injuring the transplant graft, lack of motivation, cultural beliefs, and also restart or begin sport activities. Transplant recipients don't know how and when they can start or begin to practice physical activity and sport activities. So why there are so different kind of attitudes? The possible answers are that there is a lack of counseling from transplant professionals and physician community about the benefits of exercise. The physician community have a great responsibility to communicate and stimulate the patients during their follow-up to practice physical activity, and also the benefits of exercise. And also organizational aspect arising from the difficulties from this patient to access the supervised exercise facilities. Also, we, in the Italian health system, we have a rehabilitation period soon after transplantation, but just for heart and lung transplantation, not for kidney and liver transplantation. So we organize, we create a new model, a new path for these patients. There is in the center of the triangle the patients that go every 3 or 6 months in the transplant center for the clinical assessment, like a usual care management. In this case, transplant physician do the clinical assess and if the physician considers the patient clinically stable, send the patient to the sport medicine center for the fitness assessment. So the sports physicians assess the exercise capacity, the strength situation, and also the quality of life. I will show you later the specific test. And after that, the sport physician prescribe and personalize exercise with the specific intensity and frequency and workload. After that, the sport physician send this patient to the accredited gyms, so outside the hospital, close to their house, for the administration of this prescribed exercise with supervision by exercise specialists. This supervision is very important to increase the motivation, and also the exercise is more safety. The goal of this model is a continued communication between exercise specialist and sports physician, and also between sport physician and transplant physician. We created very multidisciplinary team, and we can talk with each other with the same words. So it's for the patient, it's very important, because he feels very controlled and safe in this kind of path. And so we create this network of experts, a transplant physician that selected patient clinically stable, sport physician that carry out specific tests and prescribe exercise, and exercise specialists that administer and supervise the exercise. Also, to increase the collaboration between these different professionists, we organize national courses to meet each other, and also to make more force in this kind of network. So now the patient can decide to practice physical activity with supervision, so in certified gyms with the exercise specialist, with the supervision of exercise specialist, and also can decide to practice a physical activity without supervision, so with prescription but without supervision, for the patient that don't like to go inside the gyms. But they have to recording the exercise in a diary of health or application in the smartphone. And also, these patients with the same prescription, with the same path, can practice sport activities. So the sport physician can prescribe like a sport training, and also certify fit for sport competition, and also non-competitive sports. So in the transplant center, the transplant physician do the clinical assessment through clinical and instrument tests, blood and urine test, and also SF36 questionnaire, like a usual care management. So these tests don't cost more in the health system. These are pictures from the Sport Medicine Center for the fitness assessments. So we analyze anthropometric measurements, body fat percentage, hydration analysis, incremental test on a cycloergometer with measurement of the heart rate, lactate concentration, and oxygen uptake to evaluate the aerobic and anaerobic thresholds, and also tests related to the strength and grip test, quantum move jump test, and also one repetition maximum strength test, like a sub-maximal workload in 5 muscle groups. So this is the exercise prescription. It's the Italian version, of course. It's the first part, there is a pharmacological prescription, and in the second part there is a non-pharmacological treatment, the aerobic training and the strength training with a specific intensity, workload and frequency related to each patient. So the minimum features is frequency 3 times per week, duration of each session 60 minutes, with the cardiovascular exercise at least 30 minutes with an intensity corresponding to the aerobic thresholds, and also strengthening exercise, 2 sets of 20 repetitions at 50% of 1 RM in the 5 muscle groups. And also before the training there is a warm-up and also stretching as well. So we control the efficacy of this prescription after 6 months and after 12 months from both Sport Medicine Center and Transplant Center to control the effects, adverse events and the situation of the exercise capacity. So now I want to show you the results about the study, our study that occurred before this programming. So we analyzed 44 kidney transplant recipients that have a prescribed and supervised physical activity compared with cohort B, like a control group, without prescribed and supervised physical activity. It was 41 kidney transplant recipients. So the group was comparable in terms of BMI and also length of dialysis. So the first result was the weight loss. You can see that in the active group there was a significant decrease of fat mass and also BMI after 12 months of prescribed and supervised physical activity. No significant changes were found in the control group. About exercise capacity, we found a significant increase in max workload, VO2 max and heart rate max after 12 months of prescribed and supervised physical activity, and also anaerobic threshold significant increase. So significant improvement of aerobic and anaerobic metabolism, improvement of the work capacity and also of the cardiac efficiency. No relevant changes in the control group. About the strength, also we found a significant increase in a strength of upper and lower limb, so significant improvement of general strength with the prescribed and supervised physical activity. No relevant changes in the control group. About the quality of life, also we found a really significant increase in physical function, role physical activity and social function scales after 6 months and also after 12 months of prescribed and supervised physical activity, so a significant improvement of quality of life. About the blood chemistry, no relevant changes were found in both groups. They were stable, and just I want to show you that the creatinine was a little bit higher in the control group after 12 months, but no significant changes were found with the statistic analysis. So we can say that the active group increase, increase their creatinine values. So conclusion, preliminary results of this model show that patients who follow prescribed exercise with supervision for 12 months improve physical and mental health, as evidenced by significant weight loss, significant improvement of exercise capacity and efficiency of cardiorespiratory system, significant improvement of the strength, stability in renal function, and also significant increase in the quality of life. So for the focus is to evaluate the effects of prescribed physical activity recorded through a diary of health and with application in the smartphone, so outdoor physical activity, and also use this model for patients with chronic disease in waiting list for transplant. Also, we are very proud because we help the European Committee to write the position paper on transplantation and physical activity through these results. And so we create a group, a European group, work together to recommend and stimulate also the Europe group to say the importance of the physical activity after transplantation. And also with a lot of partners, also with Dr. Greenwood, other partners, we participate in this European project. It's called Horizon 2020, and we submit this stadium study that is supporting therapies for patients with transplant and chronic disease based on physical exercise. Also, this program was also for kidney transplant, for transplant recipients, and also for chronic liver and kidney disease, so before the transplant. So we will know the results at the end of September, so we cross the finger for this opportunity to participate in this program. So conclusion, preliminary results show the positive effect of the model based on cooperation between transplant center, sport medicine center, and the exercise specialist in the exercise prescription. These data should be considered a contribute to develop and promote further detailed exercise protocol and to foster improved post-transplantation health and survival, helping to ensure that physical activity become a safe routine medical treatment plan of patient management. Take-home message, prescribed physical activity, indoor or outdoor, could be an important tool to reduce cardiovascular mortality and morbidity in transplant recipients, modulating both traditional and non-traditional risk factors. Physical activity prescribed by sport physician and administered by exercise specialists have a positive effects and better effects on outcome like weight loss, exercise capacity, strength and quality of life. And also physical activity is one of the elements for the prevention of chronic disease and therefore must be considered as a pharmacological therapy. So exercise is medicine. Thank you for your attention.